public health officers jobless. 3. Is the council concerned about how public health cadre is noticeable being undermined and its loss taken by other cadres, including but not limited to social workers and other unrelated professionals? 4th, Kenyatta University, they have a Bachelor of Environmental Health. If in JKUAT, they have a public PhD in Public Health. They have a Bachelor of Technology in Community and Public Health. What I'm asking is, why is it that there are foreign names in different universities, yet they train the same program? 5th Chair, could the ministry give an assurance that the indexing and registration for licensing exams will be reduced with immediate effect and such changes gazetted? In addition, could the council plan on securing internship slots with stipend payment for their students scheduled for 1 year internship after the licensing exams? 6. What is the rate of students who have already done their respective degree and diploma programs but have been denied a chance to sit for the council exams in order to be licensed? And the last Chair, what is the tenure of office of a public health technician board members also who have, I think they have been in the board has been there for a while without being constituted?
Thank you, Rabukoros. I'll only allow maybe the 2 questions that relate to your first question. Then I'll request the other questions, because I've seen the in-depth. If the names of the degrees from various institutions, I might think the ministry need to be well prepared, because again, I just don't want them to answer just for the sake of answering. I request that the other questions, supplementary questions, you prepare them, we can hand them over to the ministry and they can give you a conclusive answer. Can actually even schedule another day for that answer. But for now, we allow them to answer the 2 questions that were supplementary on the matter, the original matter you had raised. Yeah, and maybe anything else that you'd want to add. But because those are 6 or 7 questions, those are deep questions, very important questions. I would not like we rush over them. I would request that you handle them over to the ministry and they can prepare better. CS.
Thank you very much. I think indeed you are correct, because some of the questions that have been raised in supplementaries relate to the Ministry of Health, but there are a number of them also that relate to the Ministry of Education. For example, when it comes to university degrees and so on, that's a matter to be handled by the Ministry of Education. You know, we kind of cooperate. So when we get doctors from them, you know, by the end of the day. But I did want to answer Honorable Koros is one thing before I hand it over to Daniel Yumbia, and that's to do with the boats. In fact, Honorable Koros through the chair, one of the reasons why we have got this retreat that we are planning on between the chair and ourselves, communication, you come on the 27th, has got something to do with the boats and the problems we are having with the boats and the necessity for legislation and so renewal of the boats. So I would like to again to leave that one for the discussion when we have this meeting that we are going to have. But I would like to hand it over to Dr. Yumbia, so that Daniel Yumbia, so that he can respond to the specific ones that you raised.
Honorable Chair, through my CS, in the absence of the CEO for the Public Health Technicians Council, I will clarify 2 things. One, it is true the board does not receive money from Exchequer, and 2, that they have been levying fees, which is indicated in the answer. However, the CS has had meetings with the health regulatory boards, and we have been instructed to review all the fees, harmonize them, and bring them to his office for discussion with this committee and the possible gazettement, so that nobody arbitrarily charges fees to the public without the approval of this committee and the CS. And therefore, in terms of that fee, it is true there are challenges, and therefore they are being addressed. In fact, we have been given a maximum of 3 months, so we expect that report to be in this committee within the next 3 months. The issue of the review of the curriculums, most of the councils have a 5-year review cycle. And therefore, with the Constitution of Kenya demanding stakeholder engagement, I think the review processes for curriculums have gone down because of the processes of review and the stakeholder engagement. Now that we are adopting the virtual meetings for these reviews to be conducted, and therefore, in the next explanation of the questions that have been answered, we shall get a detailed process indicating when the curriculum was last reviewed and when this process is going to be completed. I submit, Honorable Chair.
Just to add, Madam Chair, is also the issue that Honorable Kolos had raised regarding the human resource management and the payments thereof, which I think we can also respond to. But let me say this just generally, in terms of capacity, that we have. A is to say that allocation is generally on need basis, because some institutions or some areas need more support than others, particularly during this period of COVID. We had some temporary people that we hired, particularly community health workers. But what it has also taught us is that going forward, those are people that we might want to change the way we manage our health structures, so that community health workers take a much higher role and a much bigger role, are trained more and are remunerated, as it were. And these are budget issues that will also come to you, because it has become clear that if we were to manage the health, if we have community health workers were to be engaged more and visit people's homes, so that we take health to people's homes instead of them coming to hospitals, it would make our job easier. Because if they treat them at home before they can come, and not just treatment, it's a question of the prevention, dealing particularly with prevention, so that they are looking at cleanliness, they are looking at hygiene measures being taken in homes. That would reduce for us the disease burden. So it's an area that is under consideration, is an area we are looking at, but the whole idea being that we think that community health workers out there can play a much bigger role than they currently are, especially if the philosophy and our policy of management of health is prevention, rather than cure. Not to say that we won't balance the two.
Yes, comment from Honorable Kutuni, then we get the person who asked the question just to finalize on the matter.
Chair, the answer that has been given by Lenin Yumja and the question that these bodies are not financed from the exchequer brings into mind the question that are we actually fully implemented or operationalized the Health Act, in particular with the KH4, because that would then have solved that issue of not only the Public Health Officers Board, but actually with all the other boards. Also the issue that they are not financed from the exchequer. I may just make a point, maybe CS will note this, I'm sure he's already aware, that actually this is what is deliberately done at the time of legislation. And the authorities actually themselves seek not to say that they should be financed by the exchequer. So I think maybe this will come later, but if you have a kind of point here, the implementation of KH4 and these issues that are coming.
Madam Chair, I think Waziri, the experience that you have and also the experience that we have, I've also tried to go through the question by the Honorable Member, one by one, and I was really trying to understand what does the Honorable Member want in this board. But Waziri, I would say the bottom line of his question, I can summarize. Members become too crafty and very clever when they are raising questions. Yes, there are some which are concerned, they bring it to the public. But I think the bottom line here is the board. I think if Sengareta has been really trying to be too clever, he's a first timer, and he's really struggling, and he's really catching up. As a professional person in this area, I think they have issues with the board. Because if the board has been there for a very long time, or maybe there is no board. As someone who is an expert or a professional in that area, unfortunately for us political scientists, we don't have a board. I've been held lands committee, and all the time surveyors are complaining about their board. They want an establishment, all these, accountants and all this. So I think there is a problem. You need to sort out the issues of the board, which will now address these issues. I think clearly that is the bottom line on this question. I thank you. To you.
As I said, Madam Chair, this is going to be the basis and the basic of the discussion, in the engagement we are going to have regarding all boards in the Ministry of Health, not just this particular one, including the operationalization of KH4, as Honorable Nyikao rightly puts it. But I think that it is futile for us to renew boards for the sake of renewing a board.
Okay. Honorable Koros, you okay?
Stipend for these public health interns, I didn't get clear clarification.
Stipends
Yeah.
for the
Yeah.
public health interns.
Yes, Madam Chair, we are, there are counties that are behind in terms of payments of community health of the same that you have said. We are aware there are some counties that are behind, but we have passed the money on to the counties. We have also got challenges because some people actually employed more people than they were supposed to, even when we gave the figures. So it's an issue that we have to deal with at the county level, because essentially that's a matter that is at the county level. Some counties have dealt with it and finished, but I'm aware that there are counties that have not really cleared that issue, and we are following it up.
So, Waziri, can you give us a timeline when can we sort out this issue?
Well, if it was possible to do it yesterday, that is what I would like. But I don't want to promise something, and then I come here, and then Honorable Koros, you tell me whatever is going on. It might have to come here for supplementary, in fact, because of some of those ones who exceeded. And because a county government has exceeded, there is no reason for us to punish the person who worked there. So it might have to come here on supplementary for further support financially.
Okay. Thank you. I think, Honorable Koros, because you have many other questions that are very important questions. Kindly just put them down, hand them over to the ministry, and I think we'll be guided. Finally,
We don't know the same quarters. The minister, the CS's answer, Honorable Koros's answer. Are we talking about the same thing? I get the impression, I may be wrong, that the CS is talking about community health workers, while Honorable Koros is talking about public health officers.
part of the,
who are doing internship.
I don't want us to go into details. Part of Koros' question.
I think Koros's question is committed because public health officers are employed by, they are employees of...
Public health officers.
Yeah, they are employed. They are employees. Yeah, the interns have, I think the interns have the same issues that the community health workers, if I'm not wrong, Dr. Daniel Yumbi.
Yes, Honorable Chair, I indicated that is the wish of the ministry to ensure that all interns are paid. Initially, it was the medical officer interns and the pharmacists who were getting paid. Now, the move in the ministry is to ensure that every intern, be it a clinical officer intern, a public health officer intern, a nurse intern, are all put in the same category. And that is what is being worked on, and that is the approach we are now pushing a national agenda to ensure that every intern, and this is because those interns are also under training, and besides offering services, they are under training equally, just like the doctors. That is the approach.
And Madam Chair, Madam Chair, I would really request that you don't postpone Honorable Koros' questions. The way is very difficult. So I think if it is the ministry, if it is satisfied, and if Koros is satisfied that he's gotten a proper answer, I think
one of the things that is even clear from what Honorable Koros raised was that Honorable Koros said there is a confusion between community health workers and public health. I think part of that will be answered. And the issue of interns, CS, maybe you might need to give it a bit of some attention. I think there are some who have been called clinical officers, interns, who have been complaining also they have not been compensated. And they have sent numerous letters even to this committee. I think, as you said, the issue of all interns within your sector, within the Ministry of Health, needs to be looked at so that then there is uniformity. So that, because some seem to be compensated, others are not compensated. Members, if you allow me, Honorable Koros had asked the question. He seems to be satisfied. We agreed that the list...
Apart from the supplementary chair. So those are the questions I'll...
Yes, apart from the ones you have asked. Now, the other questions that were many, 6 or 7 of them, kindly, Honorable Koros, you are guided by the chair. Make an official, just write them, hand them over to the Secretariat. They will be given to the Ministry. And I'm very sure you'll get at least questions that are well answered. Members, if you allow me, it's almost heading to 1. It's actually 12:30. What is it, Honorable Rueda?
Asante. Nimesikia waziri akisema wale zile kaunti ambazo zimechukua hao waajiri zaidi ataleta kwa bajeti ya nyongeza, supplementary budget. Mimi kwangu naona itakuwa amefungua mlango siku nyingine tena akisema aeke namba hii watakuwa wakiongeza. Kwangu mimi maoni yangu tukienda mwelekeo huo hatutaenda vizuri. Nafaa wafuate sheria. Wakiambiwa ni hivi ni hivyo. So kama walikuwa wameajiri zaidi ni county wao wenyewe walipe. Thank you.
Mimi nimekubaliana na hiyo, Madam Chair.
CS, I think as we conclude, there was one question asked by Honorable Mauda, and because she's not here, but she raised this as a supplementary question on the floor of the House. It's important I just highlight and raise it to you. And the question was the issue, could the Cabinet Secretary provide the total amount of money and other forms of donations that have been made so far to the COVID-19 Emergency Response Fund Committee that was constituted by HE, the President, to respond to COVID-19 pandemic as at July 1, 2020. And the second question was, could the Cabinet Secretary further provide an itemized listing of all the expenditure made from the said fund as at July 1st, 2020? I'd allow you to answer that question because as it was answered last time, the member was not satisfied and raised the matter on the floor of the House. And I think if you clarify, it will be easier for me as I table these responses.
Thank you very much, Madam Chair. Let me state very clearly that the COVID-19 Emergency Response Fund Committee is an autonomous entity, and the administration of the fund is not, repeat, not, under the Ministry of Health, and hence the Ministry of Health is not in a position to competently provide responses to the Honourable Member of Gilgil. So, just to be clear, Madam Chair, the Ministry of Health has nothing to do directly with the said fund, and they do not answer to us. So I think the best thing for you is to, well, my proposal going forward, since it's public money, would be for the committee to ask for direct, to ask the chair and the committee perhaps to make the presentation directly to the committee.
Members, any reaction to that? None. Thank you. So let's go to the issues of the... I'm saying if there is no reaction to that, then... Yes, we want to proceed to the matter of the day. Okay, honorable members, we did a letter, and this letter went to the Ministry of Health, and also the letter went to the Ministry of Education, and these were the issues that we had requested them to come and answer. The first question was the current stage the country is in on the COVID-19 pandemic, given the various pandemic projections models. Contingency plans the Ministry of Health has put in place to cushion the country during the gradual reopening of the economy and movement. The role of the Ministry of Health in the decision to reopen schools in the country, and the enforcement of public protocols across the economy in the fight against the pandemic. the status of reusable face masks for the vulnerable persons in the society, and this is an amount of 300 million that we allocated as a committee as late as May this year. And the collaboration between the Ministry of Health and Ministry of Education, since science and technology in safety of learners in schools across the country. And might be any other issue that might come up. I would request the CS Health to start, and then I'll go to the Ministry of Education, and especially on the issues of the schools. And maybe we'll also add the emerging issues that have come up and the experience that the Ministry of Education has had since you reopened school, and maybe lessons learned. Thank you, CS Health.
Thank you very much, Madam Chair. Madam Chair, I don't know whether you want me to read for word the document you already have, or you like me to do a summary, and if there are any supplementary questions, because some of these issues, we have actually discussed them before, exactly the same way as they have been raised today. And you will find that the answers are essentially what they were the last time. For example, if you look at issue number 1, you'll find that there will be a lot of repetition. So I'll try and summarize the questions as quickly as I can, but hopefully as completely as I can.
Okay.
Just a general thing, Madam Chair, before I start, is that the pandemic, since the last time we spoke about it here, has not gotten better. On the contrary, we are on the second wave of the disease. At the time that we were discussing this matter, we were just about closing down, flattening the curve from a high of 13% positivity sometime in July, and positivity rate climbing down sometime in August towards September to a level of about 5%. You recall at that time, the containment measures that some of which are still in place included the closure of schools, the suspension of international travel, the closure of places of worship and entertainment places, the restriction of movement, the enforcement of wearing of masks, distancing and sanitizing, hand washing, etc., etc. Madam Chair, at about when we go to about 5%, which WHO proposes is a position where we can consider that we are generally flattening the curve. Certain of the restrictions that we had put in place were put back, de-escalated. As in, for example, the curfew now starts a bit earlier than it did at the time, and so on and so forth. We all know the measures that we had taken earlier and what happened about 2 weeks ago when we had to again escalate some of the measures that, that we had put in place. Madam Chair, as we speak, the curve is on an upward trajectory. 2 weeks ago, it was on a very steep trajectory, coming all the way from 5% positivity rate, climbing towards 12% positivity rate, and currently stands at about 16%, between 15 and 16%. For the last 1 week or so, it has kind of stabilized at about that level of about 15%, and we hope that it is going now to start going backwards. The impact of the measures that were taken by the President just about a couple of days ago will not be felt until another maybe 10 days or 2 weeks or so. So we wait to see what happens. We hope that this curve will start going downwards. Madam Chair, on the matter of the enforcement of the containment measures that we took, I think it is important for us to appreciate, as leaders generally, that a lot is called upon us. And understanding in terms of the fatigue that we can take our enforcement agencies through, they are having to do a lot of work. They have been criticized, being told that they are being too forceful and so on and so forth. But the truth of the matter is that these are necessary measures, obviously done in a humane, respectful, and lawful manner. But they are necessary for it to happen. So in terms of what we have put in place in the economic, in terms of the economy, as you know, Madam Chair, there is a committee led by the Treasury, whose responsibility is look at how to address the matter of our economy. Let me just say this, and it's important for us as leaders, as Parliament, as a committee for you to know, but also for Kenyans. to appreciate that the general trend globally in the economies of the world because of COVID-19 is actually trending towards negative. For example, Italy is operating at about -10 of the economy, or of the economic downfall is all the way to -10. We are looking at Kenya at about a +2% expected growth as we go forward. And therefore, the balance between what we have to do to maintain a stable economic environment that means that we secure livelihoods of people and so that we don't degenerate into anarchy is something that has got to be balanced with the needs held to protect the same people who we want them, who we would desire to have see working in their jobs and to sustain the businesses and to ensure that people can still afford, to live and to support their families. So, Madam Chair, with that in mind, what the ministry has been doing is developing protocols that we have distributed to the various sectors of the economy so that those protocols can guide and assist to ensure that those sectors can continue operating. For example, when it comes to air travel, we have given specific and very clear guidelines about what should happen so that people can continue, traveling, including the 96 hours that you must have a testing, and most of the airlines have adopted the same, and globally under the World Health Organization, these are measures that have now allowed us to be able to travel. You can go to both internally and externally. We are able to travel, and airlines are able to come within the protocols that have been set. And therefore, those guidelines help that economy survive. When it comes to even our matatus here in the country and our markets, the guidelines that we have given are guidelines supposed to secure the jobs of those people. When we give guidelines for the matatus, those guidelines are supposed to secure the livelihoods of those who run the matatu sector, and so on and so forth. The important thing being, A, that we disciplined ourselves to follow those protocols, and B, that there is enforcement for the same for those who abuse them. Because once somebody abuses, only one person abuses them, and then we have a huge problem. And I think the protocols also include, Madam Chair, gatherings, may they be religious, political, or otherwise, and the enforcement of the same is critical for us to be able to contain it. You will hear of many cases today where people are in church or in a mosque or in a political gathering, and then now they are COVID positive. And I think it is important for us to appreciate, Madam Chair, as I read that particular question, the cost to the economy. We are talking about how we want to reopen the economy and the economic movement. It is important to appreciate the cost to the economy of each person who is positive. Each person, the 64,000 persons who have turned positive, have a huge cost to the economy. Because you are talking about people who are possibly hospitalized, most of them could not pay, and the government has to waive. We are talking about people who are no longer going to the offices, and therefore the loss of their contribution to the economy. So in economic terms, it is good for us to define the cost of this. And therefore, when we go to these gatherings, it is good for us to appreciate the cost that we are pushing to government, and therefore the downwarping of the economic revival. Madam Chair, so in terms of the gradual opening of the economy, in terms of tourism, in terms of sports, education, we are going to look at education separately here. But also, even in terms of the East African community, we have developed protocols within the community so that we are able to move our goods and services, so that people can also move across the East African community, so that we can further enhance and prop up our economy. You also wanted us to know, the question 3 was on the opening of schools in our country. I want to skip that just for a bit and come back to that, so that we can do it together with the peers, education. But you also have the enforcement of public health protocols across the economy to fight against the epidemic. And I have said, currently we are also hearing of the Transparency International and human rights organizations that are essentially accusing the police of manhandling individuals and going beyond the call of duty as far as enforcement is concerned. I would just like to say, as I had said earlier, to repeat myself, if I may, that the onus falls on us not to force the police to enforce. We shouldn't force the police to enforce measures. And we are sometimes forcing the police to enforce measures. Because if people walk around in markets, and you can see crowding there in the markets, and people are not wearing masks, in spite of everybody telling them, the police are forced to stop everybody who wants to get into the market and to say that they must wear masks to get into the market. And as you are aware, Madam Chair, the President announced a special unit for enforcement, making drawn from various enforcement agencies to ensure that what they said is happening. And I want to thank Kenyans through you and the committee, Madam Chair, because when you look at the restrictions, particularly curfew, you can see people are actually adhering to curfew. And by and large, people are also beginning to use masks, and people are beginning to keep their distances. And Madam Chair, I would just like again to commend even this House, Parliament, because when you look at even the way we are sitting, you can see that there is a clear seriousness of it all. And I would like to ask that the churches, the communities, anybody going to a community meeting, that they adhere to the kind of thing and they look at this hall we are in and do what is being done here, so that we can be able to save more lives. Madam Chair, on the issue of the masks, yes, Madam Chair, I know that this is a sticky one. You did order a while back, and it's not just the mask. There were a couple of issues. This second wave that we are seeing is largely community spread. And what the community spread means is that in a clinic somewhere in Narok or somewhere in Mukurweini, it is likely that the clinical officer who prior to this was not exposed is going to be exposed to persons who are going to walk there with the virus. Some of it people looking very innocent and being totally asymptomatic. It therefore means that the county governments have got to ensure that PPEs are available at the lowest clinics in society. It was originally we were just dealing with hospitals. Now it is not just the hospitals. It may even be necessary for the community workers themselves to even go propped up with gear. And I think Dr. Nyikal can even assist in discussing this within the House committees and elsewhere. Because, Madam Chair, because of this, and given what you had proposed the last time, it is necessary that we as a government ensure that there are sufficient PPEs. We have PPEs at KEMSA, and I have seen these stories in the media, and essentially what has been happening, and it's good to be frank about this, is that there has been a lot of fear within KEMSA that whatever decision they take, if they take the decision to dispose these masks and PPEs to the counties at a less price that they bought it as, that eventually there will be audit queries that you then bring them here to answer the questions. But we have made it clear, Madam Chair, in the discussions with this committee in the past, that there is not a single institution that is not going to take some sort of hit, economic hit in the country. And I remember, Madam Chair, discussing it with Honorable Kutuni about if he is a landlord, he has to cut his rents. It is just the way it is. What he was charging before is not what he's going to get this year. The government itself, generally, the whole government has to take a hit because the revenues that we collected last year are generally going to be affected. And so it goes without saying that they have to sell these whatever at prices that are the current prices, because nobody can accept to buy them at the prices that they were buying at March, which was the correct price at that time. So, Madam Chair, on the issue of the masks, yes, we ordered that us to do it. As the explanation goes there in the paper, the problem with that particular order was that we want this to be manufactured by people in the streets. We want the tailors and so on in our counties to be the people who are making them. So the standardization of that issue took a bit longer than we expected, but I think it is better to take longer and be safe rather than to make masks that are of no use just to complete the order and to satisfy the fact that they are supposed to be done very, very quickly. But as for the PPEs, I will be writing to KEMSA following the discussions we had, to allow them, and as a government, to allow them to proceed and supply the counties with PPEs for the reason that we have said. So the question number 6, Madam Chair, and question number 3 are essentially the same. So I would like to respond to them in one way and to say this, that the Ministry of Health constituted a team to work with the Ministry of Education towards the reopening of schools, and this issue has been discussed by very many other stakeholders. On our part, what we did is develop protocols that are going to secure and ensure that our children and the teachers and the staff working in schools are safe. That is the first and paramount issue. And I can say without a fear of contradiction that the Ministry of Education, represented here by the PS, has had a difficult time explaining to parents, having completely mixed signals, where some parents want the kids back to school very quickly. Some parents don't want kids back to school at all. And the long and short of it is that while that is a viable discussion, and while that is a useful discussion, the long and short of it is the only way and the only parameters on which those decisions are made on the basis of what is the safety of the children. Are they safe or are they not safe? And that is why, as we speak today, the only classes that have been opened are the exam classes, for 2 reasons. A is so that they can do the exam, but B is also a test case to see to what extent are we going to have issues once the schools are opened fully. Finally, before I hand it over for the same question, additional information on the same, let me say 2 things. The first one is that going forward, what we have learned over the last 6 months of this disease, there are things that we have learned, and we have consequently adopted some new ways and new policies of dealing with the virus, so that we take benefit of what we know. For example, if it comes to the school issue, instead of saying that if we have got cases in a school in Mombasa or a school in Mukurweini, we don't say close all the schools. You surgically look at what is happening in different places and act in accordance with the position on the ground. That's number 1. So the surgical measures, including in schools, even as far as in the economy, we are closing the bars that are not following the rules, because we don't want to punish those who are following the rules because of those who are not following the rules. And I think that is natural justice. The second thing, Madam Chair, to say is this. The danger of the school child is not necessarily the child himself or herself, because the asymptomatic nature of the infection of a child is such that the danger to that particular individual, to that 12-year-old or 13-year-old, is not that high. Is actually quite low. You know, they'll get the virus, but the possibility of them being very, very sick is very low. The problem is that when they get that virus, which they won't even know, they will then go and take it home. And Madam Chair, the statistic we have is that 14% of the people who have been, out of the people who have been infected, 14% of them are the ones who are above 58 plus, above 58 years old. But that 14% make 54% of those who are dying. So clearly, we have a situation where 54% of persons who are below the age of 59, or in fact 49, are the ones who are essentially carrying the virus, but the people who are dying are the ones who are older. So the danger in relation to school opening is not just a question of the children and the teachers. It's also the virus that they take home. So I would like at this point to pass to my colleague to talk to the issue a little bit more and then respond to any supplementary issues.
Thank you very much. Yes, I think to a very large extent, you've summarized exactly what it is that we have done together as the two ministries, Ministry of Health and Ministry of Education. Picking from where you left in terms of the child being a carrier and therefore giving challenges to the adults at their homes, I would also want to look at the flip side of this, that one of our biggest problems and challenges has also been the indiscipline of the parents and the indiscipline of the adults. That we've seen in the recent past, and more so when the president opened up some of the areas in our economy, including the bus and the caterings that have been there, is that we've seen a situation where our children are becoming victims of our indiscipline as adults. Because we as adults go out there to the bus, behave in the way that we've seen in the last few days, and carry the disease to the children at home, and the children at home take the disease to the children in school, and the children in school take the disease to the disciplined parents who may have not been doing some of the things that others do in the bus. So it is a real problem that we as government, and the other day His Excellency the President was trying to deal with some of these particular issues by reducing the time that we are out there in our bus. But critically, the biggest indiscipline that we have seen among the adults has been the question of political gatherings, where we have so huge numbers of people out there participating in political gatherings in the most indisciplined way, where you see most of them are not in any preventive ways, in masks or anything else. Get the disease out there and bring it to our children in their homes. And our children innocently take it to school. And those who are in school take it to innocent parents out there. So, Chair, I would want to acknowledge that, as the CS has said, is that this is an health problem. And therefore, before we open schools, we are very grateful that we were given the top professionals that are available at the Ministry of Health. The team that was leading our team is the head of infectious diseases at the ministry. So we were given the support at the highest level that was available, so that we were able to develop together protocols. And I can say that, yes, we did develop protocols, and this is a copy of what the Ministry of Health was able to support us to develop guidelines on health and safety protocols for reopening of basic education institutions amid COVID-19 pandemic. And this was finalized in September, and you are all aware that the schools were opened in October, having gone through this particular development. And Ministry of Health and health professionals also assisted in building capacity of both the parents, through the Parents Association, the institutional managers, our school institutional managers, our learners and boards of management. So it was so critical that we were using the professionals, those who understood the disease, because we in the education sector, we are able to do what it is that we are trained to do in terms of passing knowledge to our children. The other thing that Ministry of Health ensured that we did was that they guided us on how and what is needed as running water, sanitation facilities, and the other thing that was very critical is that they created the adequate awareness among parents, teachers, and the wider community within which these children come from, So as CS has said, the protocols that were developed were done through a partnership of Ministry of Health with the leadership of Ministry of Health, with ourselves within the education sector. And I can say that the two questions, as CS has said, were similar, because when we talk about collaboration between Ministry of Health and Ministry of Education in safety of learners across the country in our learning institutions, it falls back to the role of Ministry of Health in the decision of reopening schools. Because once you reopen school, you've got to make sure that our children are safe. I'd want to mention, Chair, that on the status of distribution of reusable masks, government and the ministry has not acquired masks that we are distributing. But we have worked with partners to ensure that we take care of vulnerable children who may not be able to acquire masks on their own. And I can say that the KCB Foundation, the Kenya Commercial Bank Group Foundation, gave us 1 million masks. UNICEF has also given us 600,000 masks. This morning, we received another 18,000 masks from the Korean embassy. These are meant to target children who may not be able, from households who may not be able to acquire the necessary masks as they go to school. We are encouraging and working with the Ministry of Health also to ensure that parents acquire usable masks which meet the standards given out by KEPS and also the guidance of Ministry of Health, because it will be very difficult for our parents to sustain use of any other masks, like the surgical masks, which are used for only a day. So what we've been doing with the Ministry of Health is that we have ensured that we add prototypes that we gave to Rivertex, to Kigotech, and most of the other people out there who make these PPEs, so that they will be aligned to the requirements of our children, and these masks are usable. So, Chair, I would want to conclude by saying that Ministry of Health personnel have been very instrumental in advising schools on setting up of isolation centers, best use of school clinics during this pandemic time, and generally handling cases at school level before they are dealt with by health professionals. The other thing, Chair, I would want to say is that the Ministry of Health has also guided us in our schools forming COVID committees that involve our children, they involve our teachers, they involve our boards of management, and they involve the community within which these schools live. So with the guidance of the Ministry of Health, we've also ensured that we have aligned our learning institutions to health facilities within 10 kilometers of our schools, so that these become our first point of contact where we have challenges. So, Chair, I think with those remarks, I conclude by saying that the Ministry of Health, once again, attached to us Dr. Lois Ombajo, in charge of infectious diseases, to continuously give us the necessary advice as our schools continue. I would want to say that, yes, there has been incidences in our schools, and we have worked very closely with the health professionals to ensure that our children are safe. It was in public domain that we had quite some challenge at Kolanya Boys in Busia, and the Ministry of Health worked with us and made sure that that particular school was enclosed as an isolation center, so that we don't allow the children to go home and take home the disease. We also had a huge challenge at Bahati Girls in Nakuru, and the same was done. And as we talk now, Ministry of Health officials are technically in charge of the health, in charge of the school, one as an health facility, but critically for us as educators, that education and learning continues. So, Chair, I would want to leave at that and turn it back to CS. Thank you very much.
Thank you very much, Honour PS. I think, Madam Chair, I think I have more or less tackled all the questions that were raised. The only other addition I would like to add to what the PS said is that we have also proposed to schools that each school identifies some 2 people, possibly teachers, who can also be schooled a little bit as community workers, so that they can be able to respond quickly to situations that arise in the school. Because you'll agree with me that given the number of schools that there are in the country, it is very, very difficult to have community health workers go to every school. But it is possible for us to train, particularly because it's online training, for us to train teachers in schools to be part of the response. But I think, Madam Chair, what is important here, and I think what we should learn going forward, is that it is good for us as a Kenyan community going forward to remember what is happening today and to keep in mind that these kind of situations will arise. And when they arise, let us have the structures in schools, the kind of structure that the PS has alluded to. Let that not be a COVID response structure. Instead, let it be a readiness structure for any eventuality that might come. Because it can be a landslide, it can be a fire, it can be anything else that comes. And that level of preparedness is, I think, an issue at community levels that we need to keep going forward. The other issue, Madam Chair, is to say this, is to say that to appeal through you and the committee, to appeal to the community also and to the parents to remember the following. Number one is that now the mask is part of the dress code. When you are buying school uniform, you buy a school uniform that has got shoes, socks, shorts, shirt, and a mask. That's the norm now, particularly the reusable one. And it applies not just to school children. It also applies to us, that going forward, in fact, when we go to buy shirts, we would like to see a shirt hung together with a mask, so that you remember clearly. When you are buying a shirt, buy a mask. So it is important for it to have the behavior, the change of behavior. It's a behavioral change that the community has to use. For those who can afford in the communities, again, it is good to engage. When you are living in a community, it is always good to engage. And I want to thank, through you again, Madam Chair, the institutions that have been extremely helpful. And talking about the fund, I would also like to appeal to the fund. Perhaps they can support the Ministry of Education for those children who cannot afford it. But for those people who can afford it, they should buy it, because now it is part, as I said, it is part of the dress code. Thank you very much, Madam Chair.
Thank you, CS and PS, for your submissions before this committee. I think I will start with the easiest one, then I'll allow members also to react to the same. My concern, I've visited several schools now that you have opened, PS. And yes, it is important that we even have trained teachers who would learn to show the children even how to wear the masks. But having said that, and even when we encourage parents to be buying the uniform with the masks, I'm very sure that you have the numbers now. You know how many children you have in our schools. Have you done any kind of budgeting where we can even have the reusable mask given to every school? And to the Ministry of Health, we give money from me. It is important and very nice to consider our tailors. But if this has taken from May, now we are in November, headed to December. So do we still have to wait for these tailors? Or we have, I think I've heard the ministry saying we have Rivertex, we have even tailors. I'm very sure this matter will be taken up. Maybe it's the fear from KEMSA that people are afraid to actually transact any business with KEMSA. If the ministry today advertises, I sometimes buy dresses that have those masks, and there are people who are doing it, and they are in the villages. If the ministry takes up the matter, would we deliver this mask? Because if we had it was 300 million, would have managed to even give the students, at least the class 8 from 4s and the ones in grade 4 who have gone to school. But right now we are delaying. I think even the community, the ones who are targeting, people have come up with their ways of having their 2 masks within their localities. I think the last time I bought some, they're even being sold as little as 20 shillings. So I think what we need to do is make a decision, CS, on that money. Because I know, yes, you are willing to deal with the Chamber of Commerce through KEMSA. I think everybody else is very careful to deal with KEMSA. And I think we need to make a decision. Second is on the issue of the PPEs. You have now rightly put it that you're going to give a direction, because the last time we met as a committee, we said the ministry to give a direction to KEMSA, because they will not direct themselves on how they are to do with those PPEs. And that is urgent, so that we make sure that we are able, we are able to actually facilitate mainly our public facilities. And maybe as you brief us, you also tell us, how are we doing as a country? You know, I've gotten several calls and people tell me I've gone to Kenyatta University Hospital. There are no beds, have been turned away. I think one of our colleagues lost a brother saying they were looking for an ICU in Nairobi and they couldn't find one. Is it now that the hospitals are blocking the ICUs that can be used for COVID and other scan, or is it true that our ICUs are now full, or our hospitals are full in this country, and especially within the city center? I think it was 2 days ago when one of our colleagues lost a brother, and he said they tried to look for an ICU in Nairobi, they couldn't get one, and they lost a brother. So just give us, the reality on the ground, so that we are able to know also how to communicate with our colleagues who are also very concerned, and our constituents who are also very concerned. Rapid testing, are we doing it now? Or are we still doing it was PCR? Are we going to rapid testing? Where are we with testing as a country? I don't want to ask so many questions. I want to give my colleagues a chance. I'll start with Professor. I will go to Tongoyo, I'll go to Rueda, Koros, Nikau, then I go to Honorable Duale, in that order.
Thanks, Chair.
Sorry? Yeah, and okay, we just take maximum of three per person, so that we can be able to.
Yeah, okay.
And if a question has been asked, don't ask, so you can just choose to say mine has been asked.
Thanks, Chair. I have a couple of questions, one for the CS and one for the PS. For the PS, let me start with that. The issue of provision of masks to children. How sustainable will donations be? You have pegged your hope into donations and donors. What is the ministry doing about it? And how prepared is the ministry to ensure that sustainability of the provision of masks are there so long as children are going to go to school? That is critically important, because we want to ensure that every child has a right to have a mask as much as they have a right to have a desk. And that is where the key point for us is. The other quick question I have is for the Minister, for the CS, when he's ready. CS, you've given us quite a substantial amount of information that highlighted on the current challenges and the challenges that we've gone through. I think your ministry has done well in the beginning. And that is not to say that you're not doing well at this particular time. You identified and isolated the epicenters in the beginning, and that is how the containment of COVID-19 has been, towards a success. Did you find an epicenter now? An area where, we don't know now. We don't know where the epicenter is particularly, to be honest. I mean, as far as I'm concerned. As an epidemiologist, I should understand it faster than everybody else. I mean, that is not officially to say that I know where the epicenter is, but ideally, that will help us, isolate where the trouble is. That is where it will help us identify that we reduce this. But again, COVID is here to stay, and it will stay forever. Just the same way HIV, the same way, seasonal flus are there. COVID is here to stay. And by the way, COVID will not be a seasonal flu or a seasonal condition. It will be a condition that will be there forever. And our preparedness for that brings me back to the point of thinking sustainability, of how to harness,
rudimentary, let me even use that term, rudimentary measures to contain COVID-19 in Kenya. I stop at that. Thank you.
Thank you.
Yeah, thank you, Madam Chair. Quick 3 questions. One, I think I should start by appreciating the ministry and the stakeholders for the effort so far being put to contain the pandemic. But at the same time, Bwana Waziri, as much as we all have to take responsibility, especially as the leadership, the political class, we are a little bit disappointed to see the government officials taking the lead in actually breaking the rules. I don't know whether it happens in other part of the country, but where I come from, we get some CSS, we call them CASs, PSs, taking the lead, breaking the protocols. So I don't know, as the lead ministry, what you need to do on that. Number 2, we are hearing globally that there could be a breakthrough on the issue of the vaccine from the Pfizer and the biotech. As a country, probably, are we in any way planning for the to procure, or what is our preparedness or our plan if in case a vaccine is going to be available? Question number 3, I think this is directed to the PS education. Given the fact that the schools have been reopened for grade 8 and 4, some of these schools were earmarked as isolation centers. And taking into consideration we're in the second phase, and a little bit, cases are going up. How have we mitigated or taken accounts in case the country is going to experience more cases that goes beyond the capacity of existing hospital space? Lastly, I don't know whether this should be a question. We know the issue of the mobility of the virus, like any illnesses, is transported by human beings. And the case between ourselves and Tanzania, especially on the borders, what are we doing? And in any way, out of curiosity, Bwana Waziri, I don't know whether it has to be official. What is happening with the Tanzania? Is it that they have acquired herd immunity, or they are just dying and burying their people, not reporting? Maybe somehow you can have some information, because my constituency bordered Tanzania as well. So, yes, Loliondo, yes. So I think that is it. And I pass the mic to the rest. Thank you, Madam Chair.
Thank you, Captain Tuwaida. And we said maximum 3.
Asante. Yangu inaweza kuwa ni swali au ni wasiwasi sana. Waziri, Lamu imelipia zaidi ya milioni 120 kwa NHIF. Na tunasikia kwamba NHIF haitalipia wagonjwa wa COVID-19. Waziri, bado sisi Lamu hatuna oxygen plant mpaka sasa. Na waziri, wanafunzi kama ulivyosema kwamba COVID-19 imefika mashinani, na ikiwa kaunti nzima hatuna oxygen plant mpaka sasa, na hao wanafunzi inajitokeza kwamba wanaweza kwenda kuchukua ugonjwa wakaupeleka nyumbani wakaua wazee. Tutafanya nini? Waziri, mimi niko kwa hii kamati, watu wangu kule uniuliza unafanya nini kwa kamati. Waziri, mara mingi nimekwambia utaenda lini Lamu. Nina imani siku ile utaenda Lamu, umeona kutembelea kaunti zingine. Siku ile utaenda Lamu mambo itabadilika. Waziri, mpaka governor chini kule anasema mimi nafanya nini huku hatupeleki pesa mashinani. Anawaambia watu kwa miti kwamba sisi hatupeleki pesa mashinani. Tafadhali nenda Lamu. Hizi shida mnasema hapa, Lamu ni zaidi, hakuna hata ICU, hakuna hata oxygen plant. Mpaka sasa tunasema, mimi nimeona Lamu hapa imewekwa cluster 8 ati good. Hata nashangaa hii good ipatikana wapi kutoka Lamu. Tafadhali nenda Lamu. Asante.
we may have to change our retreat from Malindi to Lamu. It can be a solution. Next person was Honorable Koros. Was it you? No? Was it you or Dole? It was you?
Yes.
Okay. I just came down. I think the only person I did not mention was Dr. Murgo and Adagala, which I'll come back to you.
Okay, thank you, Chair. I think I have only one question, Chair, on the cost of testing. Waziri, I think we still have problem with the cost of testing for coronavirus as a country. What plans do you have as a ministry to make sure the cost of testing is brought down? And then lastly, Waziri, in most counties, even like the county I come from, it's hard to get a facility which does testing for coronavirus. Apart from, we are only lacking Kericho because we have Kemeri, Waldarit, whatever, a project. But then in most other counties in that region, we have a problem.
Yeah, you can respond, I think, to those ones first. Then we come to the second round where we'll take Duale, Kutuni, and Senior, then we go to Murgo.
Okay, I'll try to be very, very quick on each because it's quite a number. So if I sound like I'm crossing over, I'm trying to move a bit faster. First of all, Madam Chair, let me guarantee you that within a month, the whole issue of this KEMSA matter on PPEs, on the masks will be done. That is a guarantee that we can give you. The second thing on the reality regarding the position on the ground is like this. You see, the capacity across the country in terms of ICU is nowhere near overwhelmed as we speak today. Tomorrow is uncertain. But as we speak today, the capacity we have for ICU and HDU facilities is nowhere near overwhelmed. The reason why this looks like to be the case is because, for example, when you talk to Nairobians and the middle class and so on, upwards and so on, there are only 3 hospitals. There is Aga Khan, there is Nairobi Hospital, and possibly MP Shah. So that when those hospitals, and they have got very little capacity, Nairobi Hospital has got about, I think it's 77 ICU beds for everything, including COVID. Aga Khan, I think, is 56 or something like that. They have got very little capacity for the kind of situation that we are facing. So that when you call Nairobi Hospital and you can't get a bed, and you call Aga Khan and you can't find a bed, the impression given is that there is no capacity on the ground. Let me give you a very good example. Last night, I was trying to convince somebody in Nyeri to go to Uthaya Hospital. Uthaya has got oxygen, it's got ventilators, and so on and so forth, and they have got very few people in the ICU. So the same person then was brought to Nairobi, and in Nairobi they couldn't get the other 3, so they were taken to KU. KU's capacity is huge, and it is not even 50% occupied. And I can tell you, Madam Chair, one of your colleagues again called me yesterday, wanting to take a patient to KU and thinking that I have to intervene for them to have a bed. There was absolutely no point. The beds were there yesterday, Kenyatta University Training Hospital, and they got and they are there, and it is not even as we speak. It is not full even as we speak.
But I think CSN there is a breakdown of communication. Because last weekend there were 2 people who personally called me, and I even talked to the acting CEO, who indicated they were overwhelmed. And I think they're also afraid of, admitting too many people. So if somebody goes and they are like, this one, they might need to work on their communication. If then you look like you can be taken care at home, they just tell you your case is not for admission, because some people panic. When they test positive, they just want to be in hospital because they are panicking they might get sick at home. So they might need to have a way of communicating to, the public and tell them, your case is not as bad, you can survive at home, go home and stay. Maybe they are turning people away because they want to be admitted, where they feel they need to reserve the beds for more serious cases.
What I can confirm, Madam Chair, is that last night, as late as last night, I was calling Kenyatta University Training Hospital, They were not full at all. I called the Kenyatta National Hospital. I spoke to the CEO last night because I wanted to know whether this patient can be taken there. Bagabi is not full. And I know of hospitals, Embu, for example, Muranga. These hospitals are nowhere near full. And I've been there, and you know the Muranga hospital. It is nowhere near full. I think they've got about two patients. So what I'm saying is that what people are not appreciating is that the spread of the hospitals is not just Nairobi, here in Nairobi, it's elsewhere. And as I want, Madam Chair, nearly 3 months ago, telling the county government, it is that a time is going to come when you have to rely on your own county for everything. And this has come to be. It is now what is going to happen. And in the next 2 months or so, I would urge, through you, Madam Chair, through this committee and the media here present, I would urge that those governors who have not implemented the measures that we gave with the funding that we gave, to immediately do so, Madam Chair. 2 weeks ago, we got some 200 ventilators from the American government, which we are distributing to all counties, that can use them. We have been training people in the use of those ventilators. So what I'm saying, Madam Chair, is that in terms of being overwhelmed, we are not yet overwhelmed. That is not to say that we should relax or we should not take care. Currently, in our hospitals, we have got about 86 people, COVID ICU cases. There are about 86 people, COVID ICU cases. And about another 90 who are in beds, in normal isolation, in normal wards, as it were. So I think that is direct response to the question that you have asked. Honorable Sheikh, you asked a very, very important question as regards the epicenters of it all. I think originally we could easily identify those because we had Isili, we had Mvita, we had Pangani, and so on and so forth. At the moment, it's essentially community spread, and very, very difficult to identify very specific areas. I can tell you 4 counties, rather than specific areas. Let me tell you the counties. Uasin-Gishu has got issues. Nairobi County, not as bad as it was before, but it still has issues. And again, the same areas that had issues the last time are the same ones that look like they are spreading it again. We have got Kiambu, because Kiambu tends to have quite a number of people traveling from Nairobi. But Kiambu has also developed fantastic capacity in terms of ICU, in terms of HDU, in terms of ward beds, and I've been there myself to see those facilities. Nakuru has become a challenge. Over the first of a week ago, it was reporting very high figures. Now they are reporting slightly lower figures, but Nakuru, nonetheless, is a challenge. And the way forward on these issues is that you will remember when we began these things, we had closed some towns. We closed Mombasa, if you remember. We closed Kilifi at the start of the epidemic, and we are watching the situation so that in the event that we believe that it is unsustainable, and by unsustainable, define unsustainable to mean what is the level of hospitalization, what is the level of ward bed capacity, are they being overwhelmed or not? That is essentially how we will define whether to close completely or lock down an area or not. As far as sustainability is concerned, it is actually sustainability will automatically going forward for all of us in this small globe we call the world. It is a behavioral change issue. Everybody will somehow just have to change. And I think more today, you can't talk to a single individual who doesn't know of either a person who has been, who has got the virus, or a person who knows somebody who has got the virus, or has not been infected themselves. The last time we were here, I think it's Dr. who was telling us that he had been infected himself. So now we know that it's with us. And I think that The only way to sustain this situation, the only way to sustain an economy and sustain people's lives and keep going, irrespective and in spite of, and you are right, the predictions even from CDC, even in the US, is that this is not something that is going to go away tomorrow. So somehow we have to learn how to live with it. And the only measures that we can take are the containment measures, but more so the behavioral changes that are necessary to do so. On the issue of the vaccines, there was a question regarding vaccines. As you know, there are several of them now that have been announced all over the world. Yesterday, I was watching on TV, and there are some now that are being withdrawn because of the, what do you call them, Daktari? The side effects. The side effects of the drugs. You remember even Zeneca had produced a drug that had been withdrawn for a while. No, a vaccine that has been withdrawn for a while. There's a Chinese one that was being withdrawn yesterday. They were saying they won't withdraw that one for a while. There's an announcement that Abbott as Biosensor have got some vaccines. There is even the latest one that we are being told about from Pfizer. So we are watching the situation and wondering. We have also got ours that we are testing. You know, here in Kenya, welcome Kemri, are also testing one here in the country. So if you ask me, I would probably say the jury is still out. We don't have a very specific thing that we know about. We think that over the rest of the world, that in the next 6 months or so, we might be a bit more confident with the results. There are organizations globally, including the World Health Organization, the Bill Gates Foundation, who are saying at the first instance when these vaccines are available, they must be made across board, not just for the rich countries, but for all people across the world. Obviously, that is easier said than done. You have heard that UK has pre-ordered some 30 million vaccines, some 30 million vaccines from Pfizer as we speak for trial, so that they can also try them in the UK. And for poor countries, it's a challenge. It will be a challenge, but hopefully it is a challenge that we'll overcome with our own budgets and also budgetary support from where we must get it. So the jury is out. I am not sure. What I'm told, and perhaps you, Dr. Chek, are in a better position to deal with this, is my issue as a layman who is not an infectious disease expert. My issue is, I am told that this vaccine is supposed to stop you. It's supposed to stop you from getting the virus. They have tested, I don't know how many people, and they have stopped them from getting the virus. I know of somebody who shares a bedroom with somebody who is positive, and the person doesn't have the virus. So my question is this: how do they know I was going to get the virus? But that's a story of another. That's a story of another day, and perhaps I'll be educated and not ask silly questions later on the matter. But on the issue of the isolation centers, there was a matter that mentioned. I think his captain talked about isolation centers at some point, and the point is this. I think I told you earlier how we have learned some things over the last couple of months. We learned things. And yes, the schools were where we were isolating people. And at some point, if the situation were to completely worsen, it might be necessary to even then to restart some form of isolation centers. But currently, the method that we are using is essentially home-based care. And so far for us, it is working. And it is forcing people to be absolutely careful. It's bringing discipline even within the families. Because when you have got a daughter or a father or a mother who is positive, and you're managing them at home, your best friend in those circumstances is distance and a mask. Distance and a mask, distance and a mask. And you know that. And you know the person is there with you, and you know that they are positive. And the only way to save the family is to do exactly what I'm saying. And it is working. And I want to thank Kenyans for this. It is working. The largest recovery rate in the country is actually from home-based care, not hospitals. On the matter regarding our brothers and sisters across Tanzania, you know, Mheshimiwa, the only question I would ask you, and perhaps again this can be responded by our colleagues who are infectious disease experts, is how in your own county, in your own constituency, that neighbors that has got a geographical boundary, not a stone wall, not the Mexico-US wall that we have heard about. It is just an imaginary boundary that is across. This is Kenya, that is Tanzania. And somehow, in your constituency, you know for a fact that you have got cases. You know that for a fact. You are crying for isolation centers. You are crying for ICU beds to be made by your governor, and so on and so forth. So it is not something you are thinking about. It is something you can see with your own eyes. Under some form of magic, once you cross that imaginary boundary, you know, abracadabra. It's okay. There is nothing. I mean, honestly, are we supposed to believe that? You know, I mean, it doesn't take instant mathematics to know that clearly some people are managing it differently from us. And we have no way of knowing. I can't give you figures. I don't know what is going on. And because we are dealing with a friendly state, you know, I can only imagine that they have got a different philosophy on the disease from ourselves. For us, the problem, the issue is that we are a democratic society. We are an open and transparent society, and we must tell everybody everything that is going on, whether good or bad. And we share the burden together as citizens, not as leadership hiding things. We must share this burden together, citizens, government, and elsewhere. Finally, dadangu kutoka Lamu, Mheshimiwa, vile ningesema ni hivi, ya kwanza, hakuna kaunti hata moja ambayo haikupata pesa. Kaunti zote zilipata pesa za kupigana na hii virusi. Hiyo ni ya kwanza. Ya pili, pesa mashinani, kama unavyosema, pengine itaonekana na itapatikana rahisi, tukienda huko na tukiangalia ni mikakati gani imewekwa, ile kama vile masharti tumeweka inafuata, ni kanuni gani ziko huko, na tutakuja Lamu. Mimi mwenyewe tutakuja Lamu kwa sababu ni lazima tuende kila county kuzungumza na magavana, watueleze ni vipi wamefanya, na vile vile watueleze tunaweza kuwasaidia na njia gani, kwa sababu hatuwezi kujua tu. There is a reason why there is devolved government. Sisi hatuwezi kuingilia kazi ya magavana bila gavana mwenyewe kusema sisi tuko na shida hii, tuko na shida ile, tunataka usaidizi gani. Na ile mimi naweza kueleza ni kwamba mimi sijawahi kusikia kilio kutoka kwenu kusema ni wewe unalia wewe mwenyewe, na kweli na kuhurumia, lakini siasia hiyo kilio kikubwa kwa gavana akisema tunataka oxygen haraka haraka, tunataka ventilator haraka haraka ndio tusaidie hiyo mambo kama serikali kuu. Kwa hivyo tutatembea huko tushughulike na hiyo maneno, lakini pia ni vizuri viongozi kwa ujumla, nyinyi watu wa Lamu kwa ujumla, viongozi wa Lamu wote kwa ujumla, pia mshikane na muwe kitu kimoja, ndio hiyo msemo utoke kwa nyinyi nyote badala ya mtu mmoja. Nasikia sijui kama unanielewa Mheshimiwa. Nimekuwa najaribu Kiswahili lakini siwezi kama yako. Mheshimiwa Koros, the issue of the cost of testing, it is true that as a government we set it up at about 2,000 shillings. Those who want to be tested, because those we follow on contact tracing ourselves, we don't charge. On grounds that we consider that as emergency measures. We are aware, of course, that across the country there are labs that are charging a huge amount of money, and we have told them this is unsustainable and not welcome. I can tell you this, in terms of the costing of the reagents, the fast testing kits, that the issue that has been raised by the chair on the matter of the fast testing kits. Two things about them. Number one is, yes, we are going to start using the fast testing kits, but number two is that they are expensive to use. They are not as cheap as the manual PCR testing, because my estimation is it costs about $20 or so. The cost is about $20, between $16 and $20 is the cost of the reagents for testing on PCR. The cost of at the moment, it will come down eventually, but the moment is about $60 for a rapid testing kit, because they're expensive. And also, there are a gazillion of them. So we are having to rely on the ones that are recommended by the World Health Organization, and not everybody else who has come up and tell us that they have got a rapid testing kit. Because what happened originally, and I think I alluded to this the last time I was here, what happened is that countries in Western Europe and America resorted to using rapid testing kits that all eventually proved useless. And some of them they had to return. So for us, we want to, because we are not rich, with the little money we have, we want to ensure that every kit that we are using is useful, so that we can be able to bring that cost down. And we hope that as more production increases, we will indeed bring it down. But it is not cheap to test. And for the government, it is very expensive to keep on testing. And never mind that one person who is positive cannot survive on only one test, because you test them to prove positivity, and eventually you have to test them to prove negativity. And sometimes you test twice before they are proven negative. So that is 2,000, 4,000, 6,000 per individual. It is very expensive for us as a government. The testing centers we have increased substantially. I was in Kericho myself at the Cambridge testing site. They have got fantastic capacity, except that the machines they are using are American machines, Cobas machines, and it has been impossible for us to get the reagents that they would use for those machines, essentially Roche testing kits, because the Americans blocked us. So if we could get the reagents, we have a sufficient testing capacity across the country. The problem is the kind of reagents that we are getting. We have also going to increase the number of machines that we have got under our World Bank program. We are increasing the testing machines that we have to spread into counties that may not have them. So it is work in progress to expand it. We have come from 0 to over 40, so we are making progress, but still more needs to be done.
Thank you. I don't know whether Belly you had something to add, or we now go to the next level. Allow us to go to Honorable Duale, Honorable Kutuni, and then you will now do the, something was not answered.
The question was not answered. The first question.
Which one?
Maybe if I ask again in English. Yes, I asked about is it true that the NHIF is not going to pay for COVID-19 patients? Considering now we've been investing more on NHIF, paying 120 million a year, rather than investing in hospital. Is it true that the NHIF are not going to pay for COVID-19?
Is the payment of NHIF to COVID, cover to COVID?
Well, yes and no. Yes and no, in the sense that if somebody has got, the fact that a person is positive, and they are here, they respond for themselves, I wish the CEO was here. The person that a person has got is COVID positive does not mean that they are excluded from treatment. But they do have exclusion clauses, which they will themselves explain in a minute.
Okay. P.S. Pelio, did you have something to add before I give the next round of the...
Yeah, there was something that Dr. asked on provision of masks. I think, as already said by the Cabinet Secretary, is that the direction to go is that this becomes part of the essentials that the child has to get as they go to school. But what we shall do as government is that there will always be interventions. Just like we have interventions today on scholarships and bursaries, targeted school feeding program, I think as we move forward, and that's where we are going to work with ourselves and honorable members through the National Constituency Development Fund to see how do we continue some of the interventions that will be necessary to intervene. But the total coverage of all students, I don't think that will be possible, Chair. Thank you.
All right, members, if I look at time, we're already past 1:30. It's actually 20 minutes to 2. We had another session in the afternoon. So like we go brief to the point, Honorable Dwale Kutuni, then Dr. Nikau, and then Dr. Moko. You want to have a question? Okay. Just, I think we can limit ourselves to one.
Yeah, okay,
yeah,
so
one question.
briefly, thank you, Waziri and PS, for the elaborate answers you've given. And I'll just start by saying that, Waziri, in your visits to counties, we request that you visit also those counties in the north. For example, one county that you can easily visit is Garissa, where you can make the announcements. Number two, the issue of ICU and oxygen availability. I just wanted to suggest to you that as a ministry, if there is a way that we could have a toll number to call so that we can know where these facilities are available at any one time. Because sometimes, as you said, these facilities are available, but then it's not known. So the best place to coordinate such kind of thing would be the ministry, so that we can call this free toll number, where you can say we have a patient who needs ICU, HDU, or whatever, where can we tell, and then you say you are located where, and that will be one way that you can actually enhance. For the Ministry of Education, I know that we have open schools for class 4, class 8, and Form 4 secondary schools. And I think that the plan is to open schools maybe next year, if things don't go worse. Now, from the opening of the schools, do you have, whether a Minister of Health or Education, do you have an indication of the disease trend in the schools right now, so that we can actually use it as a predictor to know that once we have opened now, and we're going to open schools in a big way, how it will be. Finally, on the issue of, I think the issue of enforcement. Police are doing their work to try to enforce COVID regulations. But sometimes we see that the police might arrest people and keep them in vehicles crowded in the cells, which also puts the people at risk and also themselves at risk. What is the ministry doing to try to educate the police officers so that they don't put themselves at risk and also the public who they are arresting?
Thank you, Madam Chair. Waziri, we've been dealing with this matter for some time now. And I remember the time you appeared before the committee to give us a roadmap the government had put in place. You did indicate that there was a task force or a team of experts that was advising the government. And we agree, all of us, that earlier before, or maybe at the onset of the disease, the government, through the advice of the technical team, came in, put in place measures that actually we saw the management of the disease, the containment of the disease. It was at its best. And all of us, even including the committee, we were happy that the government were putting efforts. I remember when you appeared before the committee, I did praise you that you've been doing quite a very good job. But after the restrictions were lifted, we've seen again a surge of the disease. And the government and the president will not act alone. They act under the advice of this team. So should I say that perhaps maybe the government or the president has been misled, or perhaps maybe the team did not do proper due diligence for the government to lift the earlier restriction that we saw that it was containing the disease? And if that is the case, so, because right now it is concern of everybody. In the villages, every week we are burying not less than 10 people. And these are elderly people, 55, 65. If you go today to some hospitals, you will find the grandfather, the grandmother, and perhaps maybe even the children are in the hospital. A case that I don't want to explain, to say here in public, in most of the North Rift region, the hospitals are now becoming full, and you realize that perhaps maybe it's the entire village. Do you consider imposing the earlier measures that the government had put in place that was containing the disease? That is the ministry. And then the same committee, we expected the same committee to advise the Ministry of Education, because I'm sure the Ministry of Education has no capacity at all in containment of the disease. The PS, good enough. You've put in place the measures that you have, that is in place, including the issues of the face mask. But the face mask that you're putting in place, or perhaps maybe that you've collected from well-wishers, is only 1.8 million, it's 2 million. And the children in school are almost 10 million. These parents have no source of income. They can't even right now buy food. How will they even sustain this issue of changing the face mask, or first providing face masks for their children? Don't you think that you put the cart before the horse? Many schools are not prepared, including the parents. They were not prepared in opening school. What was the criteria that you used to arrive at the decision of opening schools? Again, don't you feel that you are so unfair to the parents now that you gave parents only 2 weeks? At least for the Ministry of Health, they were giving parents, they will give people time to prepare. But the ministry gave parents only 2 weeks. Parents were not prepared. They have no school fees. The schools are not prepared. You've talked about the protocol that have been employed in school. I want to tell you, one appears, that if you go to most of these schools, there are no face masks, there are no water point for these kids to wash their hands. If it is only one, serving 300 or 400 students. Some, they don't have toilets. Now, don't you think that you're putting the life of our children into risk? Now, you've also raised the issue of the parents misbehaving social indiscipline that is there, that the disease now is being spread by adults to the children, and then the children now bring it back to school. Don't you think that also the Ministry of Education did not prepare enough? They did not consider all these factors that are going to contribute. And then finally, don't you think that it is also time for you to review if you really think that we need these students in school, or we wait until the time the president, the way he had mentioned that we open in January, because you've got standard 4 children. They come to school and they go back home. They transmit the disease. They take to their sisters and the brothers who are in standard 1. Are we really making any headways? No. And then lastly, I wanted to register my dissatisfaction on how the minister or the cabinet secretary for education has been carrying himself. Why are we praising the minister for health? He's been updating people. You see a gentleman in him. You see a leader in him. But what we are seeing in the cabinet secretary education, we are seeing a bully. We are seeing a dictator. We don't see any leadership. And he has to apologize to those government officials that he abused. All of us. I think we have a responsibility of bringing our heads together to sort out this disease. But it is not an issue of showing how bully we are. I think it is high time also, perhaps maybe whoever appointed him, review. We are not afraid to say that. Why are we having a cabinet minister for health here who has really built trust to Kenyans on fighting diseases? For those few remarks, Madam Chair. Yes.
Who is on point of order? Sorry? Who said point of order?
So, Madam Chair, thank you. I think I need
anyway, Honorable Nyikal.
Thank you, Madam Chair.
You've been heard. Honorable Nyikal.
Thank you, Chair. Let me start with appreciating the work that the two ministries have done in very difficult circumstances with the disease whose parameters we learn as we go along. I think something has happened. Mine will be, to a large extent, comments There are many, but some of them, particularly in health, I can take with the officers because I know it works. But let's start with what happened when he reopened. I was following your data all along, and we went by the right data until you said, let's relax. Now, what actually happened after you relaxed? The guidelines you put after the relaxation were not followed. Simple. We didn't open. You said churches 200, funerals 200, vehicles you get numbers, curfew midnight to about 4, 5 a.m. And hotels and bars, you put very clear conditions on what were to be done as we opened. The truth is, Waziri, they were not followed. And my question is, why was that not done? I can count you in this town the hotels that actually followed. So then what happened? We went right back. So that is where, in my view, I saw the thing. We didn't open completely. We said, now you can go out, but you come back at this time. You can go to the bar, but you didn't this time. But we just went and did everything. Why did that happen? Number two, regarding the issue of Tanzania, this is a question again. How, no, before I go to that, with the new guidelines you have put back, there's a gap. I don't know whether I'm the one who has not seen it. It came out very clearly, and I appreciate and I accept the blame that was put on the political class. It is true. I don't think we can deny it. But again, nothing came out clearly about churches, nothing came out clearly about funerals, nothing came out clearly about weddings. So what I'm seeing, it is like weddings and funerals can go on completely. So that is a gap that we are not. I'm also not seeing clear guidelines on public transport. I'm particularly worried about local air travel. So again, I don't know what comment you can make about that. Now, with the issue of Tanzania, there's a way to look at this mystery and know what is really happening, even if we don't say it. At the beginning, there was a lot of issue about travel across with vehicles moving and particularly transporters. And the issue was very simple. Our tests were different from their tests. I do not know how you harmonize that, because that will tell us what is happening the other side. Because as they come in and they get tested, if we lowered the cutoff, then obviously if you lower the cutoff, everybody's well. So I think there we also would need guidance that you have harmonized somehow. We don't hear the noise, but what actually is happening? It can't be that when you cross the border, nothing happens. So I think we would like some guidance on what is happening at the border when you are doing the testing. Now, a few comments, because of the time, is communication. There's been a lot of improvement in communication, because when you started, you were not even giving us the percentages. Then you started giving the percentage, which was very good. Now you are giving the percentages, but there's another communication that may be needed. One, when you say Kisumu has got so much, Nairobi has got so much, it will also be important to say how many were tested in Kisumu. Because just that is so much does not give you anything to talk about. So then we know they are bad and their level of testing. That's useful. Beds, it may also, because the perception around the country is that there are no beds, we are already overwhelmed. That's what people are saying. I don't think it would be wrong, but this is a suggestion, that actually when you give figures, you say the beds that are available, and you even say where they are available. So that I'm in Kiambu and I want to come to Nairobi, I know I could get a bed in Mata or this place. Or I'm in Nairobi and I know I could get a bed in Kiambu. Because if it is ICU, then you are better off even in a small hospital in Kiambu that has got an ICU than sitting in a large hospital and you don't have oxygen or ICU. I think that information will be... Another comment, if the vaccines come, there are two worries, in my view. The cost and availability. But with the vaccine candidates all over the world have a bigger worry, the temperature. They are all saying it is minus 70 degrees centigrade. The logistics of distributing that vaccine from the airport to Busia and making sure that it is still at minus 70 degrees centigrade will be a totally new logistic. The vaccines we have are minus 4. So you just use a home refrigerator. Yeah, 220 degrees. That can be achieved by a simple vaccine you go and buy. Minus 70 is an industrial system. So what infrastructure? I would like your technical people to start thinking that if that is what happens, what are we going to do? Because even if you get the vaccine, that will really take us. Minister of Education, I appreciate one thing. Yeah, I'm finishing. You know, it is important to do this. This is Kenyans' lives, not going for lunch or having another meeting. Let's do this. If we do one good meeting, it's better than 2 meetings that didn't finish the work. So, I appreciate the fact that you realize that the danger of opening schools was not the health of the children. The children they'll be affected, but they're likely to survive without dying. Your teachers, you are likely to lose a lot of teachers over 70 or with complications. 2, the schools being the focus on spread. I'm just appreciating that realization. And therefore, the other thing that I think needs to be looked at there, when we open, like now, have teachers become frontline workers, needing some element of protection? I think that's something we need to look at. And lastly, I don't understand why you are always predicting we will open on this day, we will open on this day. This disease is totally unpredictable. You will say January it has behaved differently. I don't know, I would have taken the approach of, we will let you know. We are still protecting the children as we are, they are safe. When the time comes, we will let you know. And then if that time comes, you give a good period for people to plan. Instead of saying January, everybody is saying January is coming. January comes, no. So what is really the issue even with the minister is the unpredictability. Yeah, and I don't think I need to do that. I know you have the problem of planning the structure as go on, because some kids may even go to school 2 years older. So what? So what? But that is something that is within your system. We need not to know. We only know we are still not able to open for these reasons. When you are ready to open, you tell us and you give us a grace period. Sorry, Chair, for taking too much time, but I think I've not wasted it.
No, it's not wasted. It's very valuable. We actually just have 2, so just give it so that we wind up. One comment, so that we wind up. Dr. Murgo, then Honorable Beatrice Adagala.
Thank you, Chair. I'll be very brief. And this one will be actually a question and a comment. On the question of air travel, the air travel has already been opened. And I would like you just, Buenos Aires, just give us a brief, just 1, 2, 3, the protocols for air travel. Because in my experience, and I think last weekend I traveled from Mombasa on a local air flight, and one of the most essential protocols, I did not see it in place, particularly the question of social distancing. And incidentally, that flight, Buenos Aires, I think I could count how many people were coughing around. So really, what are we doing? On the question of vaccines, Buenos Aires, definitely the vaccines are coming. The vaccines are going to be there, vaccines with minimal side effects. And incidentally, there is no vaccine actually without the side effect. So it will come. I would just urge you, please start planning. Let us not wait until when the time the vaccines are coming, you say, we don't have money. Start now. Start planning for now. And also adding to that account the question of the temperatures which Honorable Nikala stated. The other thing is, we were doing very well when there was that lockdown. Of course, when we, released, that serious lockdown, of course, definitely there was improvement in the economy. But with improvement in the economy, there was improvement also in death. So the question is, you are releasing, okay, we are, opening it up and people are dying. Really, was that wise? And finally, for the Ministry of Education, I seem not to be with you in this question of opening of schools. If I recall very well, and I think I was seeing films of Second World War in Europe. That war was 6 years. In the whole of Europe and part of USA, nobody went to school. But did people survive? They continued. So this hurry of opening schools, infecting teachers, infecting parents, through opening of schools, was it wise really? Go and think about it. Thank you, Chair.
Thank you. Finally, Badagula.
Yeah, thank you, Chair. Bwana CS and the rest of your team, plus the Minister of Education. This is a good time that you have come together on matters concerning the health of this nation. Mr. CS, I've been listening keenly, and I've seen from your presentation, you have said where we can get a few beds for ICU and for COVID-19 patients is like Nairobi, Kiambu, Murang'a, and Nyeri. These are just a few counties. A county like my county in Vihiga, and I would even complain the way my colleague has complained about her county in Lam. As we talk now, most of the frontline workers in Vihiga, they don't have the PPEs. And it seems now as we talk, with the opening of schools, partly opening of the economy, this disease seems to have now risen in those areas, unlike before. The graph now seems to be very high. You find in one village even over 10 dead bodies. And when you hear of the symptoms, you tend to fear. To remove the fear of these people, the people living in like the county I'm coming from, what measures is the ministry going to take? I know health is a devolved function, but as much as it's devolved, the people dying, the people who are sick are Kenyan people. What measures is the ministry going to take? Like, we visited an institution here as a committee. We even saw some equipments that were not being used. As a ministry, why can't you look at counties like a county like Vihiga that has maybe 5 or so, and the population is so high? As a ministry, why can't you get maybe such, you donate to those, our counties, to assist our people? We went to Kemsa, we saw a lot of PPEs lying there. And most county hospitals, they don't have them as a ministry. Please don't tell us that health is devolved. These are Kenyans. These are Kenyans dying. An urgent intervention is actually needed. When it comes to the Minister of Education, actually, I want to echo the same sentiments. Our children are not safe in schools. Our teachers are not safe in schools. And from the time the schools were open, that's the time these COVID-19 issues are now rising like hell. Because in the villages, that's where we have our old folks. And the grandchildren go to school, they come back maybe with the symptoms, you never know. And the spread is now very high, very high. Also what I wanted to echo, although my colleague talked about it, and that one as colleagues, as members of parliament, we want to condemn it to the highest level, what the minister did, Minister for Education did in an institution, embarrassing a senior member. Even he may not be in a high post in government, but that, when you look at the pictures, he's an elderly person. You cannot do that in front of the people. Us as members of parliament, we don't condone that. PS, tell your minister to apologize to the teaching fraternity.
Point of order. Chair.
What is out of order, Captain Waida?
I don't think it's okay for Mheshimiwa to tell the minister to apologize. We Kenya, we have to take responsibility. Ukweli lazima tuseme. Nataka watolee story moja hapa niliona.
Ana story.
Ngoja nielezee. Kenyans, we have to take responsibility. Mimi I support the minister kwa hiyo. Mengine simsupport, lakini kwa hiyo hauwezi kwenda kwa class ikiwa ni chafu. Unasoma vipi, unafundisha wale watoto vipi? Kuna siku niliomba lift kwa dereva ikawa ni mzungu. Mmoja wetu akarusha karatasi ya peremende. Sikuona, naona ile mzungu ana eka emergency brake. Anasema, mimi hata tukuangalia tunashtuka shida ni nini? Ali reverse akasema, you people who don't love your country. Alirudi nyuma akaokota hiyo karatasi. Kenyans, we have to work to take responsibility. Usilaumu minister hii wa Kenya. Mimi naona hata hizi ministries zipewe majeshi zote zifanye kazi. Wengine hawaendi mpaka wafanye hivi. Usimlaumu minister sana, acha afanye kazi.
Well, I think it's good for the minister to work, but also there is courtesy and
yes, etiquette.
I think there is, we are all civil, and there is a way you can address somebody in a very respectable manner, and the same message goes in. Really, you don't have to belittle and treat a person like they are small children.
Yeah.
So
we are told to wear mask, and they don't wear mask until the.
But you can't beat them.
Push them.
I think, yeah, we are in discipline for sure, but there is a way to address an adult. And especially, I think if I saw that photo, I saw that the man was actually an elderly man. You can still correct somebody when they're on the wrong, but with a lot of decency, being civil, and with respect. It's really, when you are a minister, doesn't mean that you are like above everything else. It's good, and I think we have seen our minister here being asked sometimes some very hard questions and answering them in a very nice way. We have seen it happening. I liked when he was asked about his son going out. Yeah, if it was that one, he would have answered in a very different way. So I think it's, yes, we are in discipline, but please let's treat everybody in a civil way, in a very respectable way. I want to take it back. Maybe I'll start with you, Belio, because your questions are not many, and allow the CS to wind up and just give a conclusion. And I just want to thank you for your patience. Have been long, but we have also waited for you for some time. So, tumelipisha. Belio.
Thank you very much. Some are above my pay grade, so I'll not mention that. Thank you very much. I think most of them were really comments, but as for trends in schools and the infections, I want to say that, and Wasiri will say that because it's a medical issue, is that schools are within communities. And if infections are increasing in communities, then we would, by implication, expect some of these cases to also go up in such communities. Say that in some of the counties Wasiri has mentioned, in Nakuru, in Uasin Gishu, in Kisumu, suddenly schools within those areas, because most of our schools are day schools, if trends are going up, if trends are going up within communities, then we would be able to see and expect this to happen also within schools. Honorable Kutunyo, on the issues of masks and why we did open schools, and I said this, and Wasiri has also mentioned it, is that at some level we were managing and we were seeing that the curve was flattening at some point. And we were within or less than 5% on positivity rates. We were given some other medical indicators that were positive and that our children would be necessary to go back to school. One thing I would want to say is that in most cases within our own environments is that we as Kenyans have started moving on in so many other activities, including opening our offices, opening our businesses. I think it would have been wrong for us to have our children post their lives, while generally we were moving on as a people. And therefore there was need for us to start giving an opportunity to our children to also move ahead and move forward. Yes, we agree that with Mheshimiwa Dr. Nikar, predictions will be difficult, but it is good to plan. So I think we are just giving indications, not necessarily giving predictions that we shall be able to open, but we are giving indications that given the trend and that this may be better, and taking some of the precautions as the President did the other day in bringing back some of the restrictions that were there, we would want to believe that with these restrictions, then, and with better management and with personal responsibility, that within the next 2 months the situations will be better, and that we may be able to give an opportunity to our children to be able to progress with their lives. I acknowledge the concerns of Honorable Murgor, but you know, we are living in a dynamic world. We are now in an international global village, and we would not want to isolate opportunities of our children into this particular country without looking at the dynamics that are happening in the global environment. What we just need to do is to see how we deal with situations, but I can say that our school environment is a safer environment for our children. It is a regulated environment. One thing that we are denying and that we are not telling ourselves is that when we leave our houses in the mornings to go to where we are going, either in business or in offices or wherever that we are going, is that we are not sure where our children go to immediately we leave our houses. They go out there to play in the field. They are in an environment that is not regulated, and they are exposed. So I think we need to look at it in a more wider perspective. We have to look at all these dynamics and be able to see which one of them is a better way in which we can move forward. But the most critical thing, I would say, is that our children are safe in school, and they are safer in a regulated environment, which that regulated environment is in our school environment. And that let's give an opportunity to our children. Let's not post their lives. Yet sometimes the problem is not the children, but the problem is ourselves as adults. So I would want to leave it at that. Yes, I think we can take it from there.
Thank you very much.
There was a simple question Chair asked. How much would it cost to give children masks? Because if we say at 60 shillings, you should be able to give 2 washable clothes masks. Because I think this is something, this is like medicine. And this committee allocates money. And we will say, okay, if it is not too bad, we do it. So if we had that figure, it would be nice. I know you are a very hard-working minister. Me, I don't see him as being as bad as it's down. It's his nature. He works hard. So, but if you have that figure, we may consider to support the ministry that way.
At one time, when we were engaging ourselves within government, is that if we were to give 2 masks, we have 15 million children. We shall need almost 30 million masks. And on average, we shall require around 1 billion shillings in every 3 months. So I think we have to look at it in the totality. We are in a situation where there are declining revenues, there are competing needs, but that is what we would require. And I'll leave that to Wasiri.
Thank you very much. Let me also say that it is important, Dr. Nyikao, that we help those, Madam Chair, it is important for us to help those who cannot help themselves. That's a critical aspect. Not everybody. It is those who can help, who cannot help themselves. It is not supposed to be free for everybody. I disagree with that completely. Come away, we can't give you one. You have to buy one. So, Madam Chair, can I just summarize a little bit on the matters that have been raised? And I want first to thank you for the comments. There are some, I have got some very good takeaways. Some extremely good takeaways I've got from here, including the idea of communication issues, a lot of communication issues that were raised here that I think are fantastic ideas, including where is oxygen, available, including how we are going to manage this whole thing about vaccines. Do we get the trucks to, completely, I don't know. This is a study we have to do. I don't know what the degrees of a refrigerated truck are. So these are things that we need now to go, and perhaps working with Kemri, see how to get that whole structure done. That's a fantastic takeaway for me. So I've got some many takeaways I don't need to belabor or to start all over again, to discuss all over again. And then on the issue of air travel, they raised by Molgo, maybe indeed Dr. Kuria is here. He is in charge of public health, and I think that that falls directly into his docket. And it is true, by the way, that I flew from Mombasa the other day, and there was no social distancing. I would agree with you completely. Obviously, clearly, you are a lot more sensitive about the coughing, because I didn't pay much attention to it. Maybe it's because, anyway, but yes, you are right. You are right, Dr. Molgo, there is an issue. There is an issue there. Now, on 2 matters I want to comment on. Number one has to do with whether we drop the ball. There is this thing. Madam Chair, there is a way of ensuring that nobody gets the disease. There is a way. It can be done. Everybody stays at home. You stay at home, you don't move, you don't engage your neighbor, you will not get sick. And I think Dr. is here, will confirm that. Stay at home, on your own, you will not get sick. There is a way. The question is whether indeed that is the way, whether indeed that is sustainable, or it can be done. And the simple answer is that it cannot be done. You will notice that this second wave, Honorable Kutuni, is not a Kenyan phenomenon. It is a global phenomenon. And as has been said severally in this forum, this is not a disease that we plan for, or we understand, or we can tell what is going to happen if you do X, Y, Z. We rely largely on modeling. And let me say this. The experts that you are referring to, who are helping us before, are working harder today than then. And in fact, they are advising us even more. Now we know them even personally, because we deal with them all the time. I can tell you this is from KU, this one is from such and such a place. Even the one you say, the one advising, you just asked about the one advising the Ministry of Education. Lois is a foremost, is the leading one, even in Kenyatta National Hospital. So the ones who are leading and have got a lot more experience now through this whole thing. So there is nothing like dropping the ball. And as a matter of fact, we are still doing a lot better than a lot of other people in a lot of other countries that we know. That is not to say that we are not losing people, because one person lost is one person too many. And that's a fact. But the truth also is this, that there was never an issue where you are not going to lose anybody. No country in the world has escaped this. People are dying. All right, people are dying. And we are trying to save as many people as possible. Indeed, at the start of this pandemic, the issue was to make sure that nobody gets the virus. That was the first move. Quarantine everybody, make sure. And there were two reasons for that. The first one is to ensure that the curve of infections does not go up so steeply the way it did in Italy, that you are completely overwhelmed, that people are dying in homes and you don't know what to do. That is the first prevention, to ensure that you act in such a manner that you are still in control even as it comes. Because there was never a question of whether or not it will come. Coming, it will come, and it did come. So there was never that debate. Can we stop it completely? No. But can we act in such a manner that the curve with which the infections come is calm enough for us to be able to contain it and hold it in our hospitals? And I think so far we have. Now tomorrow, another story could come altogether. But so far, we have done exactly that. Now, the containment measures that were done, a lot of the containment measures have never been de-escalated. We have never de-escalated. The containment measures regarding weddings, public transport, churches and funerals and so on, those measures are still there. And by the way, those leading those measures actually know that they are still there. All right? Politicians know that the measures about gathering at 200, they are there, and we know them. All right? So the question is, what can these doctors do if a person has gathered people in Mukuru Wajenga of 10,000 people? What can the health officer do? So the responsibility, of to contain and to sustain what we are talking about, the restrictions, they all depend, let me tell you, my dear leaders, senators, governors, and members of parliament, and our people in the ministries. By the end of the day, we have to provide the leadership to change behavior. And if you ask me what is the most important thing, even as we discuss matters BBI, let us at the same time consider matters behavior as crucially as we are considering matters of BBI, and lead from that perspective, because that is what is going to save us. It is matters behavior that are going to save us, not matters or other things. And that is a fact, and we have to agree with it and run with it. Because by the end of the day, there is only so much locking people you can do. The other issue about the restriction measures that Honorable Kutuni referred to earlier, you see, the restriction measures also, the results of restriction measures, you do not want to create a bigger problem than the problem you are trying to solve. You could take measures that create a bigger problem than the problem you began with in the first place. And yes, you will lose some people, it is a fact, and it is very unfortunate and very, very, very sad that we are doing so. But I think you do so, you lose some people when you have got a contained situation and you can take them to a hospital, rather than when you have got riots and everybody in the streets and even hospitals are not functioning. And these are situations that are palatable. These are unpalatable, and these are situations that we have got to address very realistically and very, very much on the ground. And there is nothing you can do to shift that responsibility. So, is there going to be a time when we will know for a fact that this is the exact and totally fantastic decision to take? And my simple answer is no. That is not something I'm personally willing to promise Kenyans. But what I can promise Kenyans is that these are decisions that will be very carefully thought about, very carefully weighed, discussed by the highest brains that we have in the country, in epidemiology, in behavior, and so on and so forth. And all we can do at that point is ask Kenyans to come with us. Are we going to suffer? Yes. Let's go suffering together. Can we help each other? Yes, we can minimize the suffering. But all we can promise is we will do our best to try and contain the situation. And all the ideas that come from that end, we are going to take. There are a lot of them. We will carry them with us. I can promise you we will execute them. And if you have more, please do not hesitate to make us, to come with us. But let us at least carry Kenyans with us. As we go along, let's go with Kenyans so that they know, truthfully, let's be honest and truthful with them, that this is a global pandemic. There is going to be suffering. We have to sacrifice behavior. We have to sacrifice even money sometimes. And the only way we are going to overcome it if we work together in behavioral change. I thank you very much, Madam Chair. I look forward to the next meeting. I hope that we can all be in Malindi when 27th comes, so that we can discuss all the other matters that are pending. Thank you very much indeed.
Thank you, CS, and thank you, the team from the ministry. Thank you, PS, and for your patience. I think it has been long. From 10 you came and went back, and you've been here. So, pass our regards to the CS education.
Can I just say something, Madam Chair, if you don't mind? Just allow me 1 second. And that is to say that, different people handle things differently. And what I would like to say is that my colleague, the CS for Education, is an extremely well-meaning, is an extremely hard-working individual. I know he is a friend of the Honorable...
Point of order.
I know he is a friend of Honorable Kutuni.
Why don't you allow him
And I just wanted to say that I'm not defending anybody, but we have different ways of working, different ways of handling things. And asanteni sana.
Yeah, maybe you might need, every time there's orientation, there's some training on PR, eh? Your colleague may need some training on how to handle other people, especially
yes,
juniors.
I know, but PS, please consider remitting the money to the schools, because most of the schools, I think this thing has been covered live. Most of the teachers are saying they haven't received the term 2. Again, the 30% has not been remitted. I think it is important. And then the salaries for board of management were deducted from the initial share that had been sent to the school, so it affected the budget of the schools. And then COVID cash.
Honorable,
I think it is important. Thank you.
We'll allow you to escort the PS, and I know you can also, the teachers know you are representing them well. Thank you, Honorable Member, but yeah.
I think it would be good, Chair, to mention that we have paid monies that were due to schools.
You have paid everything?
Yes, that's important.
Okay. It's good information. So as I let the CS and the PS leave and the team, Honorable Members, we might take just 5 minutes health break, because we have Honorable Jaldesa and I've seen Gadoni wa Mushamba. We'll only have 2, and for Gadoni it's very easy. For Jaldesa it's also going to be easy. So we'll take less than 1 hour to be here, and then we can leave early. Thank you. Kuna maziwa, CS.